Hi everyone, in today's lecture we're going to be talking about children with special needs. On the first two slides you'll see types of exceptionality. So on this slide we have physical disabilities, mental retardation, learning disabilities, and communicative disorders. So physical disabilities look at children who may have neurological or musculoskeletal disabilities, and so we may see children who are in wheelchairs, using wheelchairs. They could also be using other types of adaptive equipment that help them to move their bodies from place to place. With mental retardation, this is really just looking at children who have adaptive issues and they may need more support with self-care, everyday needs due to having lower IQ. And learning disabilities, those are often ones that we are not able to see. Same with mental retardation. We might see with learning disabilities children who have dyslexia or ADHD. And this is not an issue with IQ, but it is an issue in regards to academic achievement. And then we also see learning disabilities. Communicative disorders is the last one on this slide. So this just looks at speech or language issues and how children communicate with one another. So we might see children who use communicative devices. I was actually just on a walk this morning with my mom and I saw a child who was using a communicative device as well as being pushed in a wheelchair stroller type of device, and it was so sweet because we were on our walk and I could hear the child pressing on their communication device that they wanted a snack, and I just thought it was awesome that we have so many ways that technology has been proven useful for children who have different types of abilities and need additional equipment. So many different ways that we can support children with all varying types of abilities. And on the next slide, I'll talk about the last ones. So on this slide, you'll see different types of exceptionalities, including hearing impairments or visual impairments. So children may be deaf or hard of hearing, so not being able to hear at all or variations with that. And this could be apparent right at birth, or this could come about later. And depending on the type of intervention that families would or would not like to use or have accessibility to, sometimes children use cochlear implants or hearing devices, or choose to not have any of those, or if they're not able to. And so oftentimes children who have hearing impairments will communicate through sign language. And we have children who have visual impairments or blindness, so they could be partially sighted or fully blind, so not being able to see at all. Again, variations in that, and children may require glasses or other types of equipment to be able to see things closer to them or for far away. Emotional and behavioral disorders. This can look at externalizing and internalizing. And so we were talking last week about some different types of challenging behaviors, and so many children with emotional or behavioral disorders will fall in the category of having true challenging behaviors, and so that's the externalizing portion. So those are those outward behaviors, their way of trying to communicate. And then internalizing emotional or behavioral disorders are things like anxiety or depression. So this is within themselves. And then developmental delays, those can be all different types, language, cognitive, all different types of development that we were looking at. And this could be a significant delay, or it could be something that is temporary. So it could in turn later on be diagnosed as a disability, but it could also be something that is temporary, and then as the child continues to age, they start to outgrow this delay or catch up with typically developing peers. So we may put services in place such as language or speech pathologists for the child during, the preschool years, and then they start to catch up or meet their typically developing peers, but that may not be the case, and children might then have more severe learning disabilities, and that's okay too. So this is just a marker of what that looks like. So it doesn't mean that there is a disability that has been identified quite yet, but we see a developmental delay at this time. And then we also see giftedness, which is where children have high capabilities above average. So it's important that we're also considering not only children who might be behind typically developing peers, but also ahead. So atypical development could be above or below what is typical. And all children, regardless of their exceptionality or their special needs, they need care in the classroom, and they need teachers and parents and resources to best support them. So that's going to be what the rest of our lecture is going to talk about, is barriers that often happen and ways that we can best support children. So on this slide, I wanted to share some incidents of exceptionality. So just like behavioral challenges, as we talked about last week, exceptionality, children who have special needs, is something that we should expect to see in the classroom. And this is just some statistics to show that 10 to 12% of children have a disability. So in a classroom of 20 children, around 2 or more children will have some form of a disability. And again, as we talked about, not all disabilities are going to be visible. And so it's important to consider all different types of abilities that children have and a range of services and support that they might need in the classroom, and looking at kind of what is more common or less common. So in 2017 and 2018, you can see the graphic here on the right hand side that just shows the amount of children who experience different types of disabilities during this time period, with learning disabilities being at the height of that. So again, that is a disability that is not often visible, and so many children who have learning disabilities either go undetected or don't get the proper support set in place, and this can be extremely challenging for them to be able to learn and to participate, to make friends, to connect with their teachers. So having knowledge of all different types of abilities, having knowledge of all different types of ways that we can support children is going to be key for teachers and anyone working with children. And so also having knowledge of how we serve children using the Individuals with Disabilities Education Act. So serving children and providing them with the supports that they need set in place is going to be key. So having knowledge of that. So this slide is just going to be adding on to what we talked about on the previous slide, and how there are many changes often in incidence rates. So you can see here that there might be different types of services or interventions that are set in place, and oftentimes we see changes in medical care or early intervention because we just have opportunities for better services or more resources, more knowledge, like I was saying, more technology. So we have opportunities to provide children with various types of adaptations, the equipment that they might need, all different types of personal professionals that can be alongside with a child in a classroom, and we're better at diagnosing children. So as you can see, autism rates are increasing due to more knowledge and awareness and more signs and symptoms early on that we're recognizing. And so it's been 300% in the last 10 years that we've had children who have been diagnosed with autism. And if you're currently an early childhood teacher or work in a classroom, you may be noticing that many children are being diagnosed with autism, and that is primarily due to our knowledge. We have more knowledge and understanding of the signs and the symptoms and being better able to diagnose children. And this is wonderful because then we can set early intervention in place before children are too far along in their schooling and the services would need to work extra hard, or maybe they're not available anymore. So having knowledge about this is extremely important. And it's interesting to see just differences in increases and decreases in different types of disabilities. So you can see here the arrows that are going up and down or staying stagnant over the past decade. And paying attention to this data when children are coming into the classroom is important, so that way we can accommodate and make sure that we are paying attention to all different types of special needs that children may have. On this slide, just wanted to share a little bit of information about what children actually understand about exceptionality or special needs. And so in our diversity lecture, we were talking a lot about what children know about different groups of people and how diversity looks in a classroom or in a home setting or in a community. And just like diversity with the color of our skin, the language that we speak, the kinds of cultures that we represent and believe. Having different types of abilities in a classroom also falls within this diversity category. And so having knowledge of different types of learning abilities is going to be important for children, and making sure that we acknowledge all different types of abilities that people have, and cluing children in and creating classrooms that are inclusive is going to be really important. And so that's going to be what the remainder of our lecture is thinking about how do we allow children to participate in a classroom where there are children who do and children who do not have special needs. So inclusive education is going to be key, and so that's what we're going to be focusing on for the rest of lecture. Alrighty, so let's talk a little bit about inclusive education. What is it and why is it important? So inclusive education is simply serving children with special needs and children without special needs, and creating classrooms that allow for everyone to participate. Everyone is included. Inclusive means we are including everybody with and without disabilities in the same classroom at the same time, and also thinking about how we're providing services to children, and this enables everyone to get their needs met. All developmental needs are valued and important, and we are caring for children regardless of their ability to participate in certain activities or in certain types of group play. We are creating opportunities where everybody can have their needs met, everybody can reach their goals. We are helping children to reach those goals. We are setting out individualized plans for children as needed, and no one is left out, no one is falling behind, even though there may be challenges presented. That's how life is. That's how classrooms are. Oftentimes there are challenges that may arise, and this is something that we are going to work through together, and we're going to continue to be a collaborative team, especially with different types of professionals. And so what I mean by that is thinking beyond just a typical teacher in the classroom. We want to have additional support services set in place, so therapists and paraprofessionals. So this might be speech and language or occupational therapists that we could have either in the classroom, or children can step out of the classroom and go meet with their one-on-one aides or therapists, as well as paraprofessionals. So these are professional people who work directly with children who have special needs within the classroom setting. So they might help with feeding, or they might help with adaptive equipment. So if a child needs to get in and out of their adaptive equipment in order to be able to move around the classroom or head outside, for example, or if you're on the playground and a child is in adaptive equipment and you need to move them from the equipment into the swing, or even to go down the slide, or to sit in the chair to have lunch. So thinking about this is a person who is going to be one-on-one with the child and better able to support them, so that the teachers in the classroom are able to focus on everyone and children are not being left out. And so the video at the bottom here is a great walkthrough of inclusive education, and also a historical lens of inclusive education. So I highly recommend that you check that out. All right, so on this slide, just wanted to share a little bit more about the history of inclusive education. So as I mentioned on the previous slide, the video does give a nice overview of some of the history, but here is some of it also laid out with specific dates and what that looks like. And the main point that I wanted to emphasize on this slide is how different laws are set in place, and specifically how in 1986 the PL 99457 law extended services to infants, toddlers, and preschoolers, so created opportunities for children in early childhood, which is the age group that we're focusing on for this class, to be able to have services within the classroom, which is wonderful because we want to think about not only a range of different disabilities and children who need support, but also within different age groups. So before 1986, children were not getting services in the infant, toddler, and preschool years, and so this could be detrimental to their growth and their learning and opportunities for them in the classroom, but wonderful ways that we can now support them based on this new implementation of the law. On this slide, I wanted to share some pros of inclusive education. And so we're seeing some benefits if you look at the graphic on the right-hand side. And really what we're seeing with inclusive education is that children are included in the same classroom. We are not looking at children who have disabilities as being separate learners in a separate classroom. We are saying everyone in this classroom is valued. Everyone in this classroom deserves the opportunity to learn. And so our job and our role as a teacher is going to be making sure that every child has what they need in order to learn. We are including everybody, and children without disabilities often are models for play and social interactions for children who do have disabilities. So thinking about how a wonderful blend of abilities and people and diverse needs are going to be in your classroom, and we can support each other, and we can help children who might be unsure or uncertain or even a bit more shy to participate to be able to have a safe space where they can learn and they are included. And also we might think back to our previous lectures where we talked about bias, because this is something that children might have a bias towards, is children who have special needs. And so typically developing children might have biases if they are not exposed to children who have special needs. And this is why it's really important to start early education with inclusion. And so we can help to reduce fears and create opportunities for children to have more empathy and care towards other children in the classroom who might have different abilities than that they do. So having inclusive education early on before elementary school is going to reduce those biases, and it's not going to make school as difficult for children who have special needs. So we were watching and learning a little bit about the reject video. You can't say you can't play, and so don't wait for this opportunity. Don't wait until children are in elementary school or middle school or high school to put this phrase out there. And think about how we can say you can't play early on. Inclusive education needs to happen from the moment children are starting school, and creating opportunities for children to have more directed play, because early education in early education classrooms is much more fluid with child-directed play, and we're seeing that there are a lot more activities that children can choose from on their own, many different areas in the classroom, much more open-ended in the types of activities, and there's more meaningful ways for children to interact and exist and come into this space and figure out who they are, what they like, what's interesting to them. So please check out this video, another great one to talk about the pros of inclusive education. Now, unfortunately, even though there are so many wonderful benefits to inclusive education, there are often a lot of barriers that we have to think about, but barriers can be overcome, and so let's talk about some of them. So some considerations in inclusive classrooms are often that we see staff attitudes and abilities to be able to support children with special needs are not always where they need to be and are not being met. So we don't always have a range of trainings and staff and teachers who are readily able to support a wide range of abilities. And again, going back to those biases, oftentimes teachers also have biases and those fears and that uncertainty regarding children who have disabilities. They may have never been around somebody who has had a disability before. They've never interacted with someone who's had a disability before. They don't have enough training in order to best support a child with disabilities. And so this becomes a barrier. And so they don't have the necessary skills and training in order to effectively create a space for the child who has a disability to learn and grow and exist in the classroom alongside their peers. And so the problem of not being prepared makes teachers often reluctant to serve and create inclusive education, and they're uncomfortable, and really it just stems down to those biases. And if we can help to reduce those biases, we can create more inclusive classrooms. So although it's a barrier, it's something that we can work on, and if we are more open to providing trainings and requiring folks in education fields to have training and classes and knowledge on special education, we're going to be better prepared for our workforces. So coursework needs to be related to learning about children with special needs, and we also need to create more opportunities for individuals who want to work with children to have hands-on experiences in classrooms that serve children with special needs. And unfortunately, we also see that another barrier is that it can be expensive to produce inclusive education classrooms because we might not have the types of equipment that children need. So I was mentioning children who might be in wheelchairs on the playground setting might need to move from their adaptive equipment into a swing. Now, what if the swing is not even accessible for a child who can be moved in and out of their adaptive equipment? And what if we have a child who cannot be moved out of their adaptive equipment? They need to stay in that equipment. So what about our playgrounds? Are they going to be inclusive? More likely than not, more likely than not, I'm trying to remember that phrase. That one didn't work out. More likely than not, no, it's not working, and I'm already rolling with this one. See, sometimes I mess up, and I try to normally just press the end recording and try again, but let me just think about what I want to say. So most likely we don't have playgrounds that are going to be inclusive and have adaptive equipment and be fully accessible there. Hopefully that one made more sense. And we often also have limited resources outside of what teachers are provided, and so one of our resources that we have in our local region is the Inland Regional Center. And so thinking about pairing up with different types of resources outside of the school systems and partnering with them so that we can have those different types of therapists and paraprofessionals inside the classroom, and looking around also at the environment and seeing, does this environment actually produce a space that is going to be accessible for everybody? Can tables be adjusted at different heights for children? Are there various modalities of teaching? Are there different types of materials that children can actually use? So if children are not able to grip onto materials, do we have alternatives for that? If children are not able to see or hear, do we have an aide who can move around the classroom with them in order to keep them safe from bumping into things or not knowing where they're at? If we have children who have different types of various abilities in regard to academic achievement, are we going to have the space, the time, and the understanding that they need different adaptations related to the curriculum and the learning material, the activities that we have set in place? Same with children who are gifted. If our material is not going to meet their needs, they're going to be bored in the classroom. They're not going to be interacting in ways that can best meet their learning needs. So many different ways that we don't always have the type of equipment, the type of staff, the type of trainings in order to best meet children's needs. And also thinking about this again as a workable barrier, so we can be more trained, we can work with local agencies, we can create staff and teams that are going to be able to meet children's needs. It really just comes down to, are we willing to put in the time and the effort to do this? And also, are we able to get those resources up and running ahead of time? Okay, so last but not least, on this slide and the next slide, we're going to talk about some ways to facilitate inclusion. So on this slide, you'll see that one of the biggest ways that we can do that is using people first language. So we're not identifying a person by their disability first, but we're identifying them as a person first. Now, keep in mind that some people like different ways of being spoken to, and they may, say, instead of saying a person who has autism, they might say I'm autistic, or I'm an autistic person. So it really just depends on who that person is and what makes them feel comfortable. But more likely than not, there we go, that's how I use it. More likely than not, it is most appropriate to use people first language to start out, and then if somebody wants to correct you or provide you with an alternative of how they would like to be addressed, then you can go about it that way. And really the best way to include people related to disabilities is just by using their name or the way that they like to be addressed. And if they feel comfortable talking about their disability, great. But if not, then we need to acknowledge that that's something that they can keep private. And another way that we can think about facilitating inclusion and creating classrooms that are inclusive is the way that we treat families. So really thinking especially about our early childhood classrooms, most likely we are going to be talking with families about what's going on, how we can support the child, and we want families to feel safe and comfortable just like we do the child. And most families, they want the best for their children, right? And so we really think about how we can create respect and sensitivity around whatever the families need. We're going to do our best to provide that to them. And this also comes in turn of familiarizing yourself with different types of disabilities so that you have knowledge under your belt when families do come in with potential questions or need resources. Also familiarizing yourself with different components of special education, knowing the different laws and different types of referrals that children might need, understanding the different types of support. And not all teachers and families of children without a disability have knowledge and acceptance for disabilities. So recognizing that there are going to be families who don't have a child with a disability who might feel uncertain or uncomfortable or don't know what to do and how to have their child in this space. And so again, reducing those biases, coming at this point of discussion with respect towards families and sensitivity, understanding, creating that safe space, and showcasing all of the benefits and the pros of inclusive education to really help alleviate those fears that they might have and to help them to understand that it's important to be inclusive and what opportunities can be created for children with and without disabilities in this inclusive space. And going back to the different types of laws and referrals that you might need to know, so having an understanding of this, knowing how to make a referral, knowing what an IFSP or an IEP are. And so this link here gives some great information about the individualized family service plan, which is the IFSP, serving children 0 to 3, and then the individualized education plan, which serves children 3 through the K-12 system. And so I highly recommend checking this out so that you can have better knowledge on both of these different types of service plans that can be set in place for children, what that looks like, especially if you want to work with or you are currently working with children who have special needs. Having knowledge of the different types of ways you can support them in the classroom is imperative, and knowing about the different abilities that we might see, knowing different signs that you might look for. So especially if you're working with young children, there might be certain signs that you can identify, and even though you might not be somebody who is legally obligated to make a diagnosis, you can provide opportunities for families to get referrals and identify if services need to be set in place early on. And again, it could just be a developmental delay, but if there is a diagnosis of a disability that could be set in place, it's always better to have that knowledge and have those resources early on. And considering, again, both children who are behind and ahead of their peers and every child in between. And there are tips on your textbook, page 149, for gifted children specifically. So I recommend, if you haven't read that yet, make sure you take a peek at that. And last but not least, this slide has some additional ways to facilitate inclusion. Just couldn't fit them all on one slide. So you'll see, again, emphasis on the child-initiated activities. So really thinking about different strategies that we can use that are supportive for all children. Positive guidance, authentic assessment, which we're going to talk about assessment in the next lecture. And of course, using developmentally appropriate practices with children. And the video here shows how we can use high-quality, developmentally appropriate practices in our programs to meet the needs of all children. So please take a peek at that one. And then the two additional links, the one in the middle shows encouragement for peer interactions. And so we were talking about how peer interactions are extremely important in our previous lectures, but this is essentially critical for children who have special needs. And so this article from NAYC talks about tips where all children are able to be included and how to create more supportive peer interactions for children who do and who do not have disabilities. And then last but not least, the Baby Center article gives you tips on how to talk with children without special needs and how to help them to learn about children who do have special needs and what that looks like and how to answer their questions and address biases immediately, and thinking about how children with various abilities need to be shown appropriate ways to talk about disabilities, again using that people first language, or just having knowledge of what different abilities look like. So for example, disabilities that we cannot see related to academic achievement, learning disabilities, that could be a little bit harder for somebody to grasp. Why do they get certain accommodations related to, time and related to how their schoolwork is going to go and I don't? And so having open and honest conversations with children about what different disabilities look like and what different types of adaptations and accommodations and classroom achievement is going to look like for children, and why is a paraprofessional helping a child to eat or to get in and out of their adaptive equipment? Why does this child get to use an iPad and I don't? Because, technology, lots of kids love using iPads or phones, and so why is this child using an iPad and I cannot? Well, that child actually has a communication disorder, and so they use this device to communicate. They do not use verbal words on their own, and so they press buttons on this iPad so that they can communicate with us. And so having open and honest conversations with children is going to be the best way, again, to address those biases and to create inclusive classrooms. All right, everyone, I hope you enjoyed today's lecture, and I will talk to you in our final lecture for assessment. Bye. Thank you.